From the campus of the University of Kentucky, this is Behind the Blue. I'm Kody Kiser with UK Strategic Communications.
I would say pharmacists are superheroes. They're the guardians of medication safety. They help you learn about your medicines and learn about how to use it in a way that's healthy for you. We know children misuse medications, right? That has contributed to the opioid epidemic. When I worked on medication safety research in the opioid space, we would do focus groups with kids. And what we quickly learned is children learned to misuse medications from friends in school, but also from parents. That's why the family-centered interventions are important, because our children are watching. They do what we do, not what we say. I've come to see that it's even more important to help parents understand they're learning medication use behaviors from you. When we've done research to ask kids, who would you want to learn from? The parent usually comes out at the top. They're watching, they're listening. So we found in our lab, it's so important to help parents learn about medication safety themselves. Because what happens is, as these kids grow, if we don't teach them, they get to college, and now for the first time, they have to manage their meds, and we can never taught them. So I call it medication literacy skills, like financial literacy.
That's Dr. Olufunmilola Abraham, UK professor and department chair of pharmacy practice and science, and founder of the Chrome Lab, a community-engaged research team that designs games and interventions to help families build medication literacy and communicate more effectively about health. On April 25th, the UK College of Pharmacy will host The Wonders of Pharmacy, a day of interactive activities, demonstrations, and stations that let visitors explore what pharmacists and pharmaceutical scientists do behind the scenes, from how medications are discovered and made to how they're used safely and effectively in real life. The event is similar in spirit to the UK College of Engineering's E-Day, with more than 60 stations and a choose-your-own-adventure format running from 11 a.m. to 4 p.m. On this week's episode, I talk with Dr. Abraham about this new event that's designed to make science, health, and careers in pharmacy feel hands-on, creative, and accessible for kids and families. Dr. Olufunmilola Abraham, thank you so much for taking the time to be with us on Behind the Blue.
Thank you for having me.
So for people listening, introduce yourself a little bit. Tell me what your title is and kind of what your role and responsibilities are with the UK College of Pharmacy.
Okay, excellent. So I'm the department chair of pharmacy practice and science. I'm also a full professor in the Department of Pharmacy Practice and Science. As the department chair, I head our pharmacy practice division, and that involves taking care of faculty, students, staff, making sure we're doing what we need to do to make sure our curriculum runs smoothly. I also serve on the executive council for the College of Pharmacy in that capacity. And as a professor, I spend time in the classroom teaching courses in all our degree programs, the Bachelor of Pharmaceutical Sciences, the PhD program, and the PharmD program.
And you are the founder of the Chrome Lab, and that's an acronym, CROME. Explain to me what that is.
Yeah, so that's another major aspect of my job. I'm the principal investigator for the Collaborative Research on Medication Use and Family Health. It's a community-engaged research lab, and we say our lab is not your traditional wet lab space, but really the community. In that role, I lead our research team to develop interventions to teach families, so from kids to older adults and middle age, about medication use and appropriate health behaviors to optimize their health. We design games and interventions to help families stay healthy, to help families have an easier time communicating with pharmacists and other members of the healthcare team about their medications, about their health condition, really to improve engagement in how people engage with their healthcare team and even in their family unit in managing their health and medication.
And I know that has a very personal, that's a very personally important part of your work. We'll kind of get a little bit more to that. Before we kind of get into some of the deeper stuff here, I want to kind of ask I want to end up with how your journey led you to UK, but tell me a little bit about how you personally found your way into pharmacy. And I kind of already know some of this backstory, but for people listening, was this always something that you'd planned, or did this surprise you along your educational journey?
Oh, that's an excellent question. So I always like to confess I did not want to be a pharmacist. I actually wanted to be an electrical engineer. And my dad, who passed away 2 years ago, he always wanted two children who were pharmacists. And I got to be one of those. I fought back because I thought engineering was a better profession, but I kind of learned to listen. And I think growing up in a rural area of Nigeria, learned earlier on the power of medications, and he just wanted kids that could help him learn about medications. And I got chosen for pharmacy, and I think it was really the right choice for me. So I would say, listen to your parents. Sometimes they know better than you do. And he encouraged me to pursue pharmacy right from when I was 14. He kept saying, pharmacy is right for you, pharmacy. And he tutored me most of my childhood. And he said, kind of what I see is this is the right profession. So I ended up going to pharmacy school at the University of Lagos, Nigeria, and kind of fell in love with it over time. Part of what contributed to that is I also, living in Nigeria, had multiple chronic and acute conditions. And he taught me to learn about my medicines, learn about how they kept me alive and prevented me from going blind. So I grew into loving pharmacy and understanding how medications help us. And pharmacists are stewards of the medication use process, making sure we're using them appropriately, we're using them responsibly, and managing it the right way in our home. So that's kind of how I gradually fell in love with pharmacy, and I segued into academia because in pharmacy school, I love the aspect of seeing students struggle and then trying to help them say, you can understand this material too. We just need to teach you in a way that makes sense to you. So I kind of tutored most of my time in pharmacy school at the University of Lagos and found academia was kind of my home, my career home. And I had mentors who encouraged me to pursue a PhD. I ended up at the University of Wisconsin-Madison and kind of stayed in academia. And I've never stopped teaching and researching up until now.
And so what was it that what brought you to Kentucky and to UK?
So I've kind of gone in different directions. So when I finished pharmacy school, I practiced for a little bit as a hospital and community pharmacy in Nigeria. I found that kind of wasn't for me. And then I went back to pursue my PhD at the University of Wisconsin. When I graduated from the University of Wisconsin, I was fortunate to join faculty at the University of Pittsburgh. And then I was there on faculty for 5 years. That's where I grew my love for working with the community and working with kids and designing interventions that made sense to kids to learn about their medicines. I had my first kid, and my husband was born in Wisconsin, and we decided to move back to Wisconsin. So I went back to be on faculty at Wisconsin for almost 7 years. But it's kind of home for us. I knew I was kind of outgrowing home and wanted to explore again. And my kids were older. And the opportunity at the University of Kentucky came up. And I'd known of a faculty member there from attending conferences, Professor Patricia Freeman. And I'd met her at conferences and just kind of was always curious about Kentucky. So when the opportunity came up and she was chairing it, I talked to my husband. It's like, sure, let's give it a try if you want to explore. And at the time, I had been teaching leadership at the University of Wisconsin for pharmacy students for several years. And I kind of felt like I wanted to go to apply what I was teaching and kind of see if I could make a difference. And when the department chair role opened up, I applied, and I just fell in love with the state, fell in love with the people during my visits, and and my husband was supportive, and we made the leap to come here a year and a half ago, and we haven't looked back.
I always think it's fascinating to me when people go into certain areas of study at the university and you talk to them later, and oftentimes what they think they're going to do with their degree turns into something completely different, even though it's related to that degree. And I think that's the part that I find interesting, is that so many times you might look at something and think, well, you're going to go to school and you're going to do that particular thing. But that particular thing is really kind of a large menu of things, and you can take what you've learned and go in so many different directions with that, and still be in that field, still be in that area. It's not like I'm going to go to school and then I get a degree in this area and then I'm working in biological sciences and now I'm a chef at there's a lot of different things that you can do. I always find that fascinating with that. After all of this time and all of this travel and all of these different roles that you have played, what still excites you about this work after all these years?
No, that's such a good question. So I would say I feel like I was born with being a teacher in my blood. My grandfather was a teacher, my maternal grandfather. My mom was a high school principal and teacher. My aunts are teachers. So I feel like that love for teaching and learning is just ingrained into me. And my father also helped nurture that. And that's what still excites me. I get up energized to help students kind of get excited about whatever we're teaching them and get creative in helping them learn. So that's kind of what has kept me there. I also get excited about helping people understand the beauty of science and the beauty of medicines. I tell people medicines are good, but they can also harm. They're a blessing, but they have to be managed responsibly. And so that gets me excited, is how can we help people of all ages, right from when they're young. I teach my kids, this is good for you, but you have to be a good steward of it. So that gets me excited, is being creative and helping our communities kind of figure that out, because I tell people at some point you will use a medication or you will help a family member manage a medication, and you want to be engaged in that process to get the best outcomes from it. So that gets me excited. That gets me energized.
What do your students teach you?
Oh, they teach me a whole lot. They teach me to be a better teacher. When you're giving that lecture and they're like staring at you, so okay, we have to try this again. So I think the beauty of being in a university is you're getting different types of learners. Like, I enjoy teaching. We just started a bachelor's of pharmaceutical science degree this past fall. So I love teaching kind of the new student who's trying to figure it out. Like, what am I doing, to the very advanced PhD student who's figured a lot of things out and is willing to explore and try new experiments and study. So that spectrum, they teach me how to be a better teacher and teach for different types of learners, and make sure that how we're designing our courses caters to different types of learners. So that, I think, is the beauty, is they teach you to be a better teacher, if you want to go on that journey with them.
I speak to a lot of people at the university who, in their work, they work with students who are here, whether it's in the classroom or it's in labs or it's in work studies or internships. But there's also a big understanding and a big drive towards making sure that we are also reaching out, not just to the students who are here, but to the potential students who are coming, and younger students, whether they're in high school or even, trying to do things for, kids that are even elementary school age, to kind of like you, get them introduced to a particular science or a particular area. And that's kind of what we're here to talk about today, is something kind of in line with that. And that's the College of Pharmacy is hosting an event called The Wonders of Pharmacy, and that's later in April. For someone who's never heard of it, what is The Wonders of Pharmacy?
Oh, that's an excellent question. So The Wonders of Pharmacy is a program that I created about 2 years ago at the University of Wisconsin-Madison. I was mentored by Professor Clint Scott, who had developed the wonders of physics, and that has been in existence for over 40 years. And I told him, because I had gone to the wonder of physics with my kids, that I would really love to do this for pharmacy, because often at times as a kid, I didn't even know what pharmacists did or the spectrum of what they could do. And he said, Funmi, you should totally, I'll help you figure this out. So we started, he mentored me, and we gave it a shot. And so the Wonders of Pharmacy is just like the name sounds, us trying to help you be curious about pharmacy and who pharmacists are and who pharmaceutical scientists are. So the behind the scenes of how medications get discovered, the behind the scenes of how medications get made, and the behind the scenes of all the roles that pharmacists play to make sure your medications are safe, your medications are accessible to you, and your medications are used appropriately. And so it's our pharmacy wonderland to help you see the joy we find every day when we work in this space, and also to help you know we are there for you. We often say pharmacists are the most accessible healthcare provider in any community, rural, urban. It's free to talk to a pharmacist. It's free to walk into a pharmacist. It's free to ask pharmacists questions about your medications and about your health. And that's what we want to shine the light on and do it in really creative, interactive ways. It's also a program that's built community. For us as a college, we've been working on this for months. I would say right from when I was hired, I pitched this idea and they were super supportive. So we've been working on using it for community building. All of us are involved, faculty, bachelor students, PharmD students, PhD students. So it's also community building, us working on one project and opening our doors to the community to learn from through our lens why we love pharmacy.
So our Stanley and Karen Pigman College of Engineering at UK, they host an annual event called Engineering's E-Day, which is a big hands-on day for kids and families. Is it a fair comparison to say that this is somewhat similar and that there are things going on that are interactive that you can kind of take part in as you make your way through this?
Yes, you're absolutely right. I would say it's very similar to E-Day in many regards. It's really for the community, really designed to help the community interact with us, interact with our different stations. We'll have over 60 stations for people to choose their own adventure. We actually had a station at E-Day where we showcased some of our lab games. And I think E-Day is actually an interesting comparison because I tell people engineering is built into the fabric of pharmacy. And that's one of the things we hope to have stations related to that, where you see the connections where the whole pharmacy process or medication use process requires chemical engineers and all kinds of engineering to make sure we're using our medications appropriately. So yes, very similar. I think if you like E-Day, you should totally check this out and kind of see what you think.
I like kind of the descriptions that you've been giving as far as people interacting with their pharmacists in their community because for a lot of people, pharmacy just means I'm going to a place to pick up a prescription. And the idea of consulting with a pharmacist is sometimes we just go on autopilot when we go and pick up things. But I like the fact that you're pointing out like, pharmacists actually do a lot more and they can advise you. And they, clearly when you're putting something into your body, a medication that is going to have an effect and change something in your body, that, you've got people on hand who can give you a better understanding if you're not quite sure of things that interact with these medications that people might take. And oftentimes people there are things that I think people don't even put together that like this particular thing I'm taking, the other things in my life that I might eat or other medications I might take might have a reaction to this in a way that I'm not aware of. And so I think that's interesting that, people can come to this and realize that there's a whole lot more that pharmacists do. There's a whole lot more science behind what goes on with this. And really, it is important for kids to see pharmacy and science in general as something fun and accessible, right?
That's correct. I think one of the things we're trying to show is that pharmacists, when you ask a kid, for years I did research with kids to say, do you want to talk to a pharmacist or what do you think about a pharmacist? And often at times they're not engaging with pharmacists. And this is an opportunity for them to see pharmacists wear all kinds of hats. Pharmacists are in the emergency departments. Pharmacists are in primary care. They're in your community. They're in all kind of spaces that you haven't thought about, and they do different things. The other thing I think this event tries to showcase is that pharmacy could be for almost anyone. It could be for the academic in me or the scientist. It could be for the person who just likes to talk to people in their community. It could be for the clinician who wants to be in a hospital or in critical care. So depending on kind of what you're interested in, it's kind of helping you showcase you can find an aspect of pharmacy that resonates with you if you choose that career path.
Pharmacy students here at UK are such a big part of this event. It's not something that faculty and staff are putting on alone. It's all hands on deck kind of thing.
Correct.
How are students involved in this, and what do they gain by, explaining the work that they do to kids and families instead of just kind of learning it in a classroom or lab and kind of internalizing it?
That is an excellent question. So a critical part of this, the wonders of pharmacy, is also building in leadership, innovation, community engagement, and strong communication skills for our students. So part of this program is within our leadership in pharmacy course that's required for our second-year pharmacy students. They're building these stations, but also learning to innovate, learning to communicate within teams, learning to lead teams as they build this station for the community. So they're also learning core competencies that are required for pharmacists to learn, to get their degree and to get their certification. So we call this their project-based learning of leadership and innovation. For many schools, and this is pretty innovative, many schools across the country, leadership is taught very didactically, and that's what I did for many years. And I said, yes, there's the didactic content, but they need a way to kind of learn and grow. And so this is their leadership lab. Right, and they get to showcase that. It involves, so about 24 of the stations are created by our second-year pharmacy students. 8 or more stations are created by our PhD students, and faculty have been collaborating with them for months to create these stations.
And this really is, an event that helps a student grow in ways that are not obvious on a syllabus.
Correct.
Correct. It really is kind of outside of that, but it's still a part of the whole. As you become an entire person in a sense as a pharmacist. Yeah.
And it's mentoring them through that. Right. And part of why the community outreach event is important is we prepare them the best that we can, but we're also trying to teach them that when you graduate, there's a lot of unpredictable things that you would experience, and we've prepared you to manage that and handle that. This
Wonders of Pharmacy event really, I can see where this fits into the bigger mission of the College of Pharmacy. Correct. Here. Is this, like it makes me think about, beyond the classroom, like this, as you send these graduates out into the world, like already having this skill of community engagement and outreach and how that fits into a bigger public health picture. I mean, that really does seem like it's kind of a value add to this.
No, that's correct. And traditionally, like when I went to pharmacy school almost 2 decades ago, we didn't learn these things. Right. And I think over time, we've seen that we've struggled connecting with communities where we live and work. And that's one of the reasons I also developed this program is I think as academics, we could do a better job teaching them right from day one that part of being a professional is learning these skills, but also engaging with community so they understand the impact that your work makes in their health and in their communities. So I think this is one thing that this program helps is they're being mentored how to do it, and it's okay to fail at it and get better at it. And that's part of leadership for us in pharmacy.
On the inverse of this, does hosting an event like this kind of change how the college thinks about the future of pharmacy education in the classroom and in the labs?
Correct. So I commend our interim dean for going on this journey because it's taken revamping our curriculum a little bit, especially in the required leadership course. We had to revamp 25% of it
Oh, wow.
to incorporate this project-based learning. So it's taking a lot of trust from the faculty and support to say, let's give this a try. But it's something we've known for a long time that colleges across the country struggle in terms of how to teach leadership well in a way that's really meaningful. So this is our attempt and to see how this works.
Why was this important to be a community-focused event and not just something for kind of limited to the insulated UK community? I mean, you could open this up to campus and say, yeah, we're opening, it's a campus event, but this is open to the entire community. And so what was the importance there with that?
That's a good question. So I think the importance of it is kind of a mantra for myself since being in academia is impacting the communities where we live and work, right? So if we open it up to the UK, that's where we work. But then where we live, having communities, right, from kids of all ages to adults of all ages, understand that we live by you and we're here to help. We're here to help you better manage your medication. So I think that's the crucial piece, is just stepping out of our walls and also inviting them to see our world and how that can help them.
This also seems like something that you can have parents walking away maybe with a lot more to talk to their kids about in regards to this. What are you kind of hoping that they walk away with or talk about with their inside their family after they leave?
No, that's a good question. So like for my lab, a huge part of what we do is family-centered interventions, and that's intentional because I believe that medication and health is never managed alone. It's managed within the family unit or with a social support system of some kind. And so a lot of this is, I care a lot about how can we increase communication within the home about health conditions, medications. And so these stations have been intentionally designed to be family-centered, where you're interacting and learning together, and hopefully you continue those conversations that you start at the Wonders at a Pharmacy event at home. And that also changes how you interact with the next healthcare provider.
If a kid goes home and says, I didn't know pharmacy could be like that, that's a win, right?
That's a win for us. So I have to shameless plug, our lab is going to have a gaming section where all kids will get to do is play games about cancer, dementia, medication safety, moving. We're launching 2 of our new games, Moving is Medicine and Outsmart Dementia. So they'll get to learn in a lot of fun ways, antibiotic stewardship. And so we hope that they continue those conversations and it increases their love to learn more about how to safely and responsibly handle medications.
That's excellent. Before we started recording, we were talking about our kids. If a 7-year-old, 8-year-old, 9-year-old, 10-year-old asked you, what does a pharmacist really do? And you've got that quick moment to tell them, what do you say to that kid?
Oh, so I like cartoons. So I would say pharmacists are superheroes. They're the guardians of medication safety. They help you learn about your medicines and learn about how to use it in a way that's healthy for you.
That's excellent. It's good that you mentioned that because it does. I kind of want to come back to talking about something we talked about earlier, and that's the Chrome Lab. Can you give me a little bit more background on that?
Okay, happy to. So I started the Chrome Lab when I was a faculty member at the University of Pittsburgh. And really at the time, the dean at the time, she's retired now, Patricia Krobo, had this vision of pharmacists being more out in the community, and that we transitioned from doing research just in a wet lab or data, but really truly understanding how communities thought about pharmacy, thought about medications, and we moved the needle on that. And I was kind of that first experiment faculty because she knew I loved being in the community, and she called it a match made in heaven. So we went on that journey, didn't really know what we were doing, but we knew pharmacists needed to be in the community and doing research to better understand how to do that well. So that's what my lab is designed to do. I call it a community engaged research lab. where our focus is to partner with communities, so community centers, community pharmacies, to figure out how are people thinking about their medications, questions they have about their medications, questions they have about their health and how their medications intersect with their health, questions they have about how to interact with a pharmacist or healthcare provider. So helping them design interventions with them. So we usually say our interventions are designed with the community, for the community, by the community, and respecting their input through that process, such that the interventions we design for cancer education, for opioid education, for dementia education is sustained in those communities. And that's what we find, is that when we design with the community, we can proactively see why they may or may not use the intervention. They're better champions of the intervention in their homes and their communities. So that's kind of what we do. We design, we kind of get creative and are open to that feedback to design what's best for the community. So that's what we do, and we design all kinds of interventions.
And, that, again, we were talking earlier about, interacting with your local pharmacy, your local pharmacist. Again, that kind of calls that to mind to me, of that idea of the importance of following those instructions that are on that medication. I think that is something that is so often not necessarily taken as seriously sometimes as it should be. And so, like, for me, just on here talking to people listening, I want to stress that to people, because I know people in my own family that kind of do those things of like, well, I took this and now I'm feeling better, and so I didn't feel like I needed to take the whole course of it. Or I have some stuff left over from the last time I was feeling bad. I'll go back,
common.
And like those types of things, we kind of downplay the severity of it, but there are really severe things that we can find ourselves, situations we can find ourselves in. And so, it's always important. There's never enough that people can know about medication safety, I feel like. And so I commend you on the work that you're doing with both this event and also with the lab and the work that you're doing.
So what you're saying kind of speaks to me. What I've seen over time that's worth considering is we know children misuse medications, right? That has contributed to the opioid epidemic. What that line of work taught me when I worked on medication safety research in the opioid space was we would do focus groups with kids. And what we quickly learned is children learned to misuse medications from friends in school, but also from parents, right? So that's why the family-centered interventions are important, because our children are watching. They do what we do, not what we say. So I've come to see that it's even more important to help parents understand they're learning medication use behaviors from you. When we've done research to ask kids, who would you want to learn from? The parent usually comes out at the top. Mm-hmm. But often at times, parents don't realize that they're checked out and they're picking up on those habits. They're watching, they're listening. So we found in our lab, it's so important to help parents learn about medication safety themselves. Empowering parents we have a tool called the Family Medication Safety Plan to have dialogue about how to responsibly manage these medications. Because what happens is, as these kids grow, if we don't teach them, they get to college, and now for the first time, they have to manage their meds, and we never taught them. So I call it medication literacy skills, like financial literacy. They need medication literacy skills, and the parent is still one of the best people to do that, because they're not often engaging with the pharmacist or their physician.
Wow, excellent. Well, the wonders of pharmacy does seem like a good entry point for that, for families to come and kind of get that messaging and get the ball moving in that direction. I want to leave people with some information on the event. We are going to have this event on April 25th.
Correct.
And what time does that happen?
So 11 a.m., 11 a.m. to 4 p.m. It's a choose your own adventure. At 11 a.m., we'll have a welcome with our dean and myself, just giving a brief history, kind of pointing you in what direction to go. We have over 60 stations spread throughout the Lee T. Todd building for you to kind of enjoy at your own pace with your family and pick up prizes at the end.
And so this is at the College of Pharmacy's building on campus on South Limestone. I would encourage people to come and check that out on April 25th. It is the Wonders of Pharmacy. Is there a website that they can go to get more information?
There's a
about
Wonders of Pharmacy website. And also really cool is our Pharmacy Leadership Society, our student org at the college. They made a video that I think is awesome to watch that showcases what you could expect. And it's the perspective of students, pharmacists saying why you should check out the event.
Excellent. We will post the link in the show notes for this podcast. Also, you can just go to Google and search UKY Wonders of Pharmacy or UKY College of Pharmacy, and you can make your way to that website with that information. There's something I want to ask you about kind of in the midst of all of this, and that's how your perception of where pharmacy is right now and kind of where you maybe see pharmacy moving in this world of AI and artificial intelligence, and how people are using that both inside of pharmacy and as people in the community who are looking for answers for things, who may be trying to find medical information. I know we've talked for years and years about people who, they felt bad, and so they had an appointment with WebMD, and they got their medical information online. But both outside pharmacy and inside pharmacy, as these students come and they start to, this starts to become a bigger part of their education and of their work environment. What's your take on where we're heading with AI?
No, that's such a good question. So I could go in multiple directions. I think it's here to stay. I think one thing I've thought a lot about is, what does responsible use look like? How do we prepare the next generation to responsibly and authentically use AI and understand the pros and cons? Not too long ago, Pharmacy Today had an article on AI and medication safety. And I've seen even in the community folks using AI to diagnose and to learn about medicines. I don't think that's going away. So I've thought a lot of how can we prepare the next generation of pharmacists to understand how communities are using AI, to ask questions about that, to engage in those conversations, because sometimes it's not giving the correct information. So thinking about the implications for medication safety, I think that's huge. We are already seeing it being used in clinical settings to amplify and support pharmacists. So thinking about how does that change interactions with patients. So lots to think about and understand and study. We're also seeing how it's being used to teach. I think there are pros and cons to that. So preparing even faculty to teach appropriately, so it's amplifying their learning and still sparking curiosity and creativity. But I think we're all kind of learning as we go, and I think it's creating spaces to have those conversations and to authentically learn how people are using it so they could use it responsibly and smarter is kind of what I think about. But I think kind of like the internet or computer, new inventions are scary, but we figure it out. Humans are very smart. We figure it out, and it's creating open spaces for us to learn about the implications of these technologies.
I do think it's interesting from an educational perspective. If you look at parallels, in the College of Medicine, I've done some things recently with College of Medicine, and they've had some students in the college who developed an AI language model called the Socratic Tutor to help them and help their classmates. And it, asks board certified questions to help them prepare. And so what they took away from it was that the students who developed this were way high up in their class. They didn't really need
more tutoring.
Really a whole lot of help. I mean, they were already in a good spot, but they wanted the extra help. But their takeaway was, we are in a lot of these classes where you have students at the top end who are already familiar with a lot of the information that's being presented, and so kind of losing focus on it. You have students at the bottom end who are not prepared for the information in that class, whether they just didn't get what they needed from the class preceding that or whatever. And then you have a middle group who it's right where they need it. And so their idea was to kind of develop a thing which can help, lift everyone based on their need. And I do find that interesting in that, teachers can use those types of things and students can use those types of things to really help tutor themselves along
Amplify
and
their
become
learning.
better students, become better professionals based on, those types of things. I agree. There's a lot of misinformation and there's a lot of weird things that you can get out of it, but I do see a lot of potential there for kind of the baseline things of facts and figures and getting those types of things right in your head.
Yep. It kind of the term I like to use is it amplifies learning. One of the interesting things our lab is exploring right now with our Moving is Medicine game is games are very costly to develop, is applying AI to make them more quick, to develop them quicker and more cost effective. And that's kind of going well. That's one of the games we'll showcase at the Wonders of Pharmacy. It's saving us a lot more time, and the development cost is also much more affordable than I've ever seen with any game I developed. So I think it has lots of benefits, and we shouldn't shy away from it, but lean into it and kind of understand the pros and cons. And I think it will only get better as we learn.
Excellent. Thank you so much, Olufunmilola Abraham. I appreciate the time that we've had to be able to talk about this. It's super exciting. I hope that there's so many people that come out for this, and that both the community and the students and the college as a whole really get something off the ground here that becomes another tradition here at the university.
Yeah, we have over 500 people registered. So we're pretty excited. We're gearing up. So we hope to see you there. Thank you for having me.
Thanks for listening to Behind the Blue. Behind the Blue is a production of the University of Kentucky. For more stories about how the University of Kentucky is advancing our Commonwealth, visit uknow.uky.edu.